Today we are going to discuss about smear layer. Now, what is basically smear layer? Smear layer is a layer of debris that attaches to the tooth surface after cutting using hand or rotary instruments. Now, for cavity preparation, we use hand and rotary cutting instruments. So, after preparation of the tooth, when you view the tooth under a microscope, you can actually appreciate a thick layer of debris that is attached over the tooth surface. And this is basically produced by instrumentation of enamel, dentine, or the cementum. And smear layer was first described by an author called Boyd in 1963. And when viewed under a scanning electron microscope, the smear layer is seen as an amorphous, irregular, and a granular layer. So, what you basically need to understand about smear layer is the fact that it is a layer that is formed on the surface of the tooth after you prepare the tooth with a hand or a rotary cutting instrument. And when you view that smear layer under a microscope, you'll be able to appreciate a amorphous, irregular, granular layer. And smear layer was first described by Boyd in 1963. Now, the morphology, the composition, and the thickness of a smear layer basically depends upon the method of tooth preparation. That is, with what material you are preparing the tooth, whether it be a tungsten carbide burr or a diamond point, or whether it be a hand instrument. So, the smear layer will be thickest when the tooth is prepared by a coarse diamond point without using any coolant. Such a smear layer would be easily washed away from enamel, but it has a tendency to get adhered to the dentin. Let's see about the composition of a smear layer. Smear layer basically consists of three main components: shattered and crushed hydroxyapatite, fragments of denatured collagen, which has a gelatinous consistency due to the friction produced by heat, and abundance of bacteria as well as saliva. Now, we have seen in the first slide that a smear layer is formed after you cut the enamel, dentine, or cementum. So now we know from where we got this hydroxyapatite, collagen, and all. Crushed hydroxyapatite we mainly is acquired from the enamel, fragments of denatured collagen from the dentin. And since our oral cavity has saliva and normal bacterial flora, the smear layer will also contain bacteria and saliva. Now let us see the main two components of a smear layer. When you view a smear layer under a scanning electron microscope, you will be able to appreciate two major layers. One is a superficial smear layer. Second one is a smear plug. Now the superficial smear layer is a loosely attached layer to the underlying dentin, about 1 to 5 micrometer in thickness. The layer underneath the superficial layer is called the smear plug, which will be seen as occluding the dentinal tubules to a thickness of 1 to 10 micrometers. In this picture, you can appreciate the superficial smear layer and the smear plugs. The smear plugs are occluding the dentinal tubules, and the superficial smear layer is seen as a layer on top of the dentin. This is a beautiful scanning electron microscope picture wherein you can easily appreciate the dentinal tubules, which is occluded by the smear plug, and a layer of superficial smear layer. Now, the main controversy surrounding smear layer is whether it should be retained or whether it should be completely removed. There are basically two schools of thoughts corresponding or regarding smear layer. One school of thought is that we should retain the smear layer. Second school of thought is that smear layer must be completely removed or modified. Now, let us see the pros and the cons of retaining as well as removing the smear layer. First, we'll see the pros of why a smear layer should be retained. Researchers who are supporting this particular school of thought believe that smear layer can actually act as a natural protective barrier for the pulp and hence it should be retained. They also believe that smear layer can reduce the permeability of dentin by almost 90 percentage, the results they got from in vitro studies. Some may say that a complete removal of smear layer to favor bonding might actually increase the permeability of dental tubules and increase the flow of dental fluid. And this flow of the dental fluid can actually interfere with adhesion because the hydrophobic resins do not adhere to a hydrophilic substrate even though resin tags are formed in the dental tubules. So it is advisable to retain this smear layer to reduce the dentinal permeability. Another reason the authors are saying is that open dentinal tubules will permit access to the pulp by bacteria and also their byproducts and toxic chemicals such as acids, and hence use of bonding agent that can penetrate the smear layer and incorporating it into the bonding is the beneficial process. So it is important that we retain the smear layer. Now let us see what are the pros of removing the smear layer. Authors who are supporting this school of thought believe that smear layer is actually a debris which is 25 to 30 percentage porous in nature and has submicron channels through which dentinal fluids can easily pass. So it will not be able to efficiently prevent long term diffusion of fluids because they are porous. Restoration micro leakage can also happen along the enamel margins. Smear layer should be sealed. And since we have seen that smear layer contains saliva and bacteria, it can definitely act as a source of microorganisms. And because of the weak attachment of smear layer to the underlying dentin and its brittle nature, retaining a smear layer can actually be detrimental to bonding and hence they must be completely removed. All these factors can lead to a cohesive failure of bonding. So let us summarize why a smear layer should be retained and why it should be removed. The school of thought supporting smear layer should be retained believe that smear layer will act as a protective barrier for pulp. The open dental tubules are actually a pathway for bacteria and toxins, and hence smear layer will reduce the permeability and block these toxins from reaching the pulp by decreasing the permeability by almost 90 percentage. And overall, presence of smear layer will promote adhesion by acting as a barrier between the hydrophilic dentinal fluid and the hydrophobic resin. Now let us see or let us summarize again the points which the authors believe that smear layer should be removed. Studies have shown that smear layer is basically porous in nature and therefore the dentinal fluids can easily pass through them, and hence the idea that a long-term diffusion can be completely stopped does not work. It can lead to micro leakage and therefore it should be sealed. And from the composition we have seen that smear layer is an abundant source of microorganisms and it can also be permeable to bacterial toxins. Therefore, if you retain the smear layer, it can be detrimental to bonding because of its weak attachment to its underlying dentin, its brittle nature. All of this will prevent a proper adaptation of the restoration. So the current concept or the school of thought is the fact that smear layer should neither be completely removed nor should be completely retained. Smear layer should be modified. And what do you mean by modifying a smear layer? The idea behind modifying the smear layer is that we completely remove the superficial smear layer, but we will retain the smear plugs which occlude the dentinal tubules. Thank you.